Therapeutic Termination. Terminación terapéutica.
Introduction to termination. Addressing the end of a therapeutic relationship between a social worker and their clients is an important phase of the therapeutic process. According to the NASW Social Work Dictionary, termination occurs when the goals are reached, when the specified time for working together has ended, or when the client is no longer interested in continuing services. While terminating with clients may seem straightforward, a social worker's ethical responsibilities may need to be considered, including boundaries, conflicts of interest, and client self-determination. This is because, more often than not, the therapeutic relationship is a highly valued one, and as with the end to any relationship, it can bring up a variety of thoughts and emotions by both the client and the clinician. So it is important for social workers to understand their ethical responsibilities, be knowledgeable of the termination process, and reflect on their own termination style.
The following guidelines may be helpful to social workers as termination is explored in practice. Prepare for termination from the beginning. Termination should be discussed early so both parties can have a number of sessions to discuss ending therapy. Integrate conversations about the termination of the social worker-client relationship in the informed consent process. It helps the client create realistic expectations of the therapy process. Maintain boundaries and keep relationships professional. When ending the professional relationship, because treatment goals are not being met, clearly articulate and discuss this with the client and explore alternative options, such as referral to another professional. Consult with a colleague or supervisor when complex termination matters are being addressed. Social workers should assess the client's ongoing treatment needs prior to initiating termination. Have a discussion about how to anticipate and resolve future problems and how to find additional resources to call on as future needs indicate.
There are many different successful ways in terminating with clients. However, there are some key points to keep in mind. In session, it is important to discuss what went well for the client during the therapy sessions. Have an open conversation with the client on what the ending will look like, and remind clients when the last day of therapy will be. You might want to inform the client when the last day of session will be 5 sessions before and keep reminding them during the following sessions. For younger children, you might want to make something visual like a calendar. Explore the client's feelings about the therapeutic relationship, including the sense of loss about ending the sessions, as well as both positive and negative reactions to the therapy and the therapeutic alliance. Emphasize positive takeaways from the session. Assess improvements. Help the client understand the changes. Discuss plans for continuing to practice the new behaviors and understandings learned in therapy. Provide additional resources if needed before the last session with the client.
Patients with personality disorders or disorders of an attachment may be particularly sensitive to feeling abandoned or upset as a result of ending the therapeutic relationship. For these patients, it is important to discuss treatment termination in an empowering and thoughtful way, recognizing and normalizing their fears, assuring them safeguards are in place, such as emergency resources and booster sessions, and encouraging them via reminders that the purpose of CBT is self-management of symptoms. Reviewing what was learned. The last session should be spent reviewing and recording the different cognitive and behavioral skills that the patient has learned. You can ask questions such as, what have you learned as a result of our time together? Is there anything that was particularly meaningful to you about our time in therapy? As patients may generate skills or benefits of therapy not known to you, they should also be encouraged to keep the other handouts completed during the treatment as a reminder of their skills.
Termination does not always mean the end. If you are able to and are open to discuss this with your client, you may explore ways for them to reach out if other situations occur that require mental health services. Therapists and clients who allow themselves to explore endings are doing some of the best work in order to go through a healing process. Termination is supposed to be healthy for both client and social worker. Gracias por ver este video.